Knock, knock. Good morning. Hi, Chester. My name is Marie. I'm going to be your nurse today. I'll provide some privacy and wash my hands. Can I verify your name and date of birth, please? Perfect. All right, today we're going to do a dressing change, and then I'm going to draw some blood from your central line. So I did verify the order, and now I will come in and do that. So I did wash my hands. I'm going to apply some clean gloves. The first thing I'm going to do is just assess the site and look at it. Make sure everything is still intact. And all right, so I'm going to remove this dressing first. From the outside in, on all the corners. All right, let me know if there's any discomfort, okay? And I will give the patient a mask as well and have the patient make sure he turns his face away. So he's got a mask on. We don't want his breath getting in there. And I just remembered I probably will have a mask on as well, not in my sterile kit. All right, so we will go ahead and take this off, being very careful here. Outside in. A little hard on the table. Being careful not to move the line itself if possible. I'm going to be very careful, obviously, not to cut it. We are clamped, so that is good. Okay, still doing okay, Chester? Perfect. All right, and I'm being very careful again not to move this line because I don't want to cause the patient any discomfort. To use some good stuff on this dressing line. All right. Okay, perfect. All right, throw that in the garbage. And then we're gonna go on to doing sterile, okay? So, we're gonna first, I'll just make sure I look at the site to make sure everything looks good. And then we're gonna do sterile. So I'll take my gloves off, garbage these. And then I'm going to wash my hands real fast, hand hygiene, and then start sterile procedure. Have this a little bit higher, I think. Okay, I'm very careful when I open my new sterile kit. Okay, do this one first. My hands are super sweaty. We're gonna have to call that good. Good enough. All right, Chester, sorry about that. Just fixing my gloves here. Okay, so that was the trash. And then I'm going to take this drape and I'm gonna place it below the patient here on his chest. It will not stay, but that's where it would be. And I will take this out. And next I'm going to measure it. We're at 10 centimeters. Perfect. I have this up. This is going to go into the trash. All right, and I'm going to clean it. So I'll break this open, shake it, clean really good around the patient here, from dirtiest to cleanest. Clean down the line if it's dirty. And I'll put this in the garbage. And next I will place this on the patient. Hold it in place with some tape if I need to. And this is sterile tape, so we are okay. And then lastly, take this bad boy off. Get him covered up. Not sterile anymore, which is fine. And the last thing I will do is get my patient labeled with my initial name, my name, the date, and the type that I used. Okay, perfect. Okay, so we are done with the sterile portion, so I will change my gloves. All right, Chester, you still doing okay? I'm gonna next do a blood sample, okay? We're doing the sash method, so I'm gonna put on new gloves. Can never have too many gloves. I'll wash my hands real quick and then I'll put on my new gloves. My hands are a little bit, I would get a new glove, but they're in short supply. All right. My hands are so sweaty. I'm so sorry, Chester. It's hot out there, okay? All right. All right, so the first thing, it is clamped. We're going to flush saline really slowly. So I will open this and then I will clean it for 15 seconds. This port and this port, I just opened this too. They're both sterile. Clean with alcohol for 15 seconds. I'm gonna open, unclamp. After this is already in, we're gonna flush 10 cc very slowly so it doesn't bug the patient. No pain, no gain. Doing okay, Chester? Okay, perfect. Really slow flush. And we're just making sure it's patent here and there's no air bubbles in it. That's good. I double checked that before I injected him. So we're gonna pull it out really slow again. All the way to 10. Perfect. Clamp. Take off. That's garbage. Clean again for 15 seconds and now I'm gonna obtain my blood specimen. I will check the lab tube, it requires 3. I'm gonna unclamp now. Remove 3 mils. Clamp. Set this aside. clean for 15 seconds. And then I'm going to do my last final flush here, just to ensure that there's no air. We are clean here, and we'll flush 10. Again, very slow. Unclamp, slowly flush. Okay, you doing okay? Okay, perfect. Just let me know if there's any discomfort. Perfect. All right, now I'm gonna clamp again. Open. This is a sterile alcohol swab tube thing, cover. That is on good. Lastly, for the blood draw specimen, hopefully this guy works, because I'm gonna attach this syringe and puncture if it wants to go. We've used this guy a few too many times. Oh, perfect, nice and slow. All right, and then I will shake it up just like this. Okay, Chester, you doing okay? All right, I'm gonna label this with his name, date of birth, and the time. Perfect, all right, I'm gonna send this right off to the lab. I'll clean up my area, all my trash, ensure the patient's comfortable with the call light, and ask him if he has any questions, and send them straight to the lab. Thank you. All right, knock knock. Hi Chester, I'm Marie. Again, we're gonna do your blood draw real quick. I just provided privacy. I just washed my hands and put these fresh gloves on. So we're gonna just do a quick blood draw. Name and date of birth, please. Perfect. Any problems with blood draws in the past? No? Great. All right, so this is a pretty quick procedure. Any allergies or anything like that? No? All right. And he said he does pretty well usually with blood draws. So first thing I'm gonna do is apply the tourniquet. All right, got that nice and tight. All right, and then I'm gonna clean the site. This is a fresh alcohol wipe. First I'm gonna feel. All right, this is a good vein. Up and down, side to side. Circular motion. Get it really clean. And this is a fresh tube here. And this is fresh as well. Have all my supplies ready. All right. I'm gonna poke and bevel up. Make sure the bevel's up. Perfect, got the flash. Release the tourniquet. Feeling that. All right, that is good. Set that down, get my alcohol swab ready, and apply pressure. And I'll sharps this, and I will apply pressure for 30 seconds or up to 5 minutes if the patient's on blood thinners. Make sure the patient's comfortable. Anything else I can do for you today? Okay, I'll clean this area up and be out of your hair. Thank you. Hi Chester, I'm Marie. I'm gonna be your nurse today. We're gonna start an IV and give you some medication. So first thing I'm gonna do is confirm you are who you say you are. Perfect. Provide privacy, and I will wash my hands. I did just verify the medical order, and the provider wants us to start an IV and administer some morphine. Do you have any allergies, any medication allergies? Have you ever had an IV before? Okay. Did you have an arm that works well for you? You prefer it on your right arm? Perfect. No left-sided or no right-sided problems, and you're left-handed? Great. All right. So, have you, you said you have started an IV, or you have had an IV before. Are you usually a pretty easy stick, or is it pretty difficult? Pretty easy? Perfect. First thing I'm gonna do is drop the medication. I did verify the provider's order, and I would typically do this at the med station. So first I have the ampule. We have 2 mils is how much med we're giving today. And I did verify the patient's allergies. So I'm gonna first do this. And again, I wouldn't do this at the bedside. This would probably be at the in the no talk zone cabinet. And I typically would have another nurse verify this since it is morphine. and I will put that in the sharps container along with this. And then I'm gonna just verify my dose. And I will waste this into the sink or wherever my facility policy is. So we're gonna be right at 2. And then I'm going to take this needle. And this needle, I would probably actually recap here if that's what they wanted me to do. Then I would put this in the sharps, set this aside. All right, so now I'm ready at the bedside with the patient, and I'm going to get new gloves, wash my hands, provide privacy, verify everything, and get the patient started with an IV. So I double checked all my supplies, looks like I have everything. First thing I'm gonna do is assess the site, see if he has any rashes, anything like that. I'm gonna get this tourniquet in place here, just to get a good look. This vein looks really good here. First thing I'm gonna do is get kind of everything ready. I'm gonna clean the site with this, pop it, shake it, and I'm gonna clean it really good, side to side, up and down, scrub it, and then in a circular motion. And then I will get my needle out, remembering that this is sterile. And all right, bevel up, this is how I'm gonna do it. I cleaned the patient, and I'm just gonna double check where my bevel is. All right, here we go. Doing okay, quick poke. All right, I did see a flash. Doing good. All right, perfect. I'm just gonna secure this here. Of course, my gloves don't wanna. Doing okay. Perfect. All right, so we got this on. This is clamped to make sure we're not getting any air in there. All right, you still doing okay? Perfect, so it looks like it's good. We did get the flash of blood. I did move the tourniquet. So the next thing we're gonna do is probably flush this a little bit, just make sure it's patent. Actually, I think I'm going to do my dressing first. All right, does that feel okay? No discomfort or anything? Perfect, okay, so I'm going to do the Tegaderm, and I would do the sticky spray if need be. All right, my guy came up. I'd probably get a new one here, but make sure that's good and on. And I will initial and date this as well, just so everybody knows. That's on there really good. Okay, so first we're going to run some med here through. So I'm gonna clean this with an alcohol swab for 15 seconds. And then I'm gonna push, the order says to do just 5, to flush it with 5. So I'm gonna unclip, make sure there's no air bubbles in here, and then we're gonna push 5 cc, really slow here. Okay, it looks like it's nice and patent, so we're gonna then, and I also should have mentioned that I would have primed this tubing before doing this. I would have primed this tubing with saline solution, just to make sure I didn't get any air in the IV. So I have it locked there. Now we're gonna push this med. I probably at this time would do another double check of the medication, just to verify that you know, we have the right patient, all the patient rates and everything. So, all right, and we're gonna administer this over 2 minutes. So we will start now. And I'm going to monitor him very closely for just signs and symptoms of any type of medication reaction. I'm going to watch his breathing. We've already done his vital signs, so I'll probably make sure we get another set of vital signs about 30 minutes after we administer this medication. And then I'm going to just kind of talk to him through it. Are you feeling okay? Are you having any trouble breathing or anything like that? How's your pain? Is your pain okay? Perfect. All right. We're doing good. We're about halfway done. And I'm just checking my watch, making sure we're doing this over 2 minutes. Just making sure the patient's doing okay. Also monitoring the site, making sure it looks good. And it's good. So we have 1 minute left. So, which is perfect because we've done one ml so far. So, and after this, we will flush it with 2 mLs is probably fine, just to make sure we get all of the medication through the tubing and whatnot. Still doing okay? Perfect. We have about 30 seconds left. Perfect. How about that weather outside? It's so sunny and beautiful. Yeah, it's really nice out, huh? Perfect. We're almost done. We're down to a few more seconds here. All right, 5, 4, 3. Still doing okay? 2, 1. Perfect. Okay. Now I'm going to flush that tubing and that med, and I'm going to continue to do this very slow, okay? Because there's still medication in the tubing, so we're going to do this over 2 minutes as well. Really slow, just make sure that full med gets into your system here. So after 2 minutes, I will reclamp the tubing, and then I would have a cap that I would put on here, and I will clean up this mess. And then the next thing I'm going to do, I'd probably leave, and maybe a few days later I'll come back, or maybe later this shift, and we're gonna the doctor ordered, I checked that he wants to discontinue your IV. So that's what we will do next. So the first thing I'm going to do is just look and assess. I have new gloves on, I've washed my hands. I verified the order several times, and we're ready to discontinue your IV today. So the first thing I'm gonna do is peel off your plastic here. This shouldn't be too difficult if my gloves will cooperate with me today. Okay, got this all off. Doing good. All right, this is just a quick amendment. All right, so, all right, doing good. All right, I have my gauze pads ready. We will discontinue, have the patient breathe through the procedure, and I will keep that on there. I will visualize this to make sure it is still intact, and then I will put this right in the sharps container. And then I will hold this depending on how long, if the patient's on any certain medications, but that's how long I will hold this on pressure-wise, and depending on where at on the body as well. So doing okay? Do you have any questions today about the procedure or medication given? No? Okay, perfect. Well, I will get all this cleaned up and then be out of your hair.